right. In fact, that is a very beautiful question. First, let's do the analysis of how a vaccine comes about. Now, the first point is this. For you to develop a vaccine, you must understand the entire life cycle of the disease. That is the first thing.
Have we understood the life cycle of the disease?
Of course. Now, before, 30 years ago, if you want to send a letter, you go to post office, you take 2 weeks, 3 weeks, 4 months before the letter arrives at the destination. Today, you send an email, you send WhatsApp. So technologies have developed. We are at the point where once a disease is identified, the entire genome is sequenced. That sequencing is important. It means that if you know the sequence A, B, C, D to whatever sequence you know, it means you know the particle that is responsible for stimulating immune response. So what the people who develop vaccine will look for is to pick that subunit that is stimulate the immune response. So we'll talk about immunogenesis. So that subunit will be immunogenic. So it will be able to develop, stimulate your body to produce those cells that will fight the disease. So it's possible. It's possible. In a matter of weeks, sequencing of any gene is done. So that is possible. So people are worried, oh, it took us a very short period to do that. Now we have an emergency at hand. 2, we have scientists who have done sequencing of the virus. 3, we have people who have capacity for vaccine development. They can just pick the subunit of the virus that now is immunogenic and then produce a vaccine from it. Now, people are afraid, what is a vaccine? A vaccine is just a picture. The technology that's being used now is not the virus itself. It's a picture, it's a subunit, it's recombinant strategies that are used to get a subunit of that stimulate the immune response. So I'll give you an example. Suleiman, we're here today. Now, if I want somebody to know who Suleiman is, I just need your picture. Now, that picture is not Suleiman. So I take a picture, show it to somebody. Now, that person sees Suleiman, and if subsequently the individual sees you physically, depends on the instruction that I've given the person. I say, okay, please hug Suleiman. The person sees Suleiman. Oh, this is Suleiman, hugs you. If I say slap Suleiman, the person sees Suleiman, slaps you. That is what the vaccine is all about. It's just, in fact, the technology says that it's just a picture of what the virus looks like. And then it's not exposed to your body. The body then develops the immune cells that fight off the disease. Once the individual is now exposed to a disease, in its real form, the body cells are ready to do that fighting. That is the whole process. And that process can be done very fast because we now have technology for it.
Well, the doctor is still here with us, and you can do well by sending in your contribution, questions, observations. Of course, you can do that via the number being displayed on your screen right now. Now, Dr. Terfa, still on COVID-19, we know that you are a medical statistician and you deal with data, you analyze data and then provide solution to how we can deal with some certain, challenges in the country. Now, you know that COVID has actually, yes, we're experiencing, the second wave right now. The numbers are, shooting high up there, but the casualty, the effect of COVID-19 is not much felt in the country compared to other climes. The number of people being affected, number of deaths being recorded, and all of that. What really is responsible? Have you taken time to, do your observation, making inferences from those observations you have made as a medical practitioner?
Okay, so the spectrum of factors responsible for outcome of disease, even for an individual. If I sneeze down on you, chances are that you may not catch a cold. Another person sitting by me may catch a cold, isn't it? Now, so there's a spectrum of response of individuals, of communities, of nations. Now, if you look at that, there are so many factors that we cannot at this point convincingly say this is what is responsible. But we'll share different geographical locations. We have different exposures to illness that by nature also stimulate us to develop immune response. We have so many factors that differentiate us from other countries. So for now, somebody cannot convincingly lay hands and say, this is what is responsible for this. But again, we have empirical evidence to know that these differentials will contribute to our better outcome that we're seeing.
Okay. Now, we are looking at, we're in an era where, homegrown solutions are being encouraged, in different sectors, and health is not out of place. Now, what do we need to do differently to, encourage, those who are, engaging different avenues to ensuring that they provide homegrown solutions for COVID-19 pandemic in the country?
You see, the one thing I tell people is that the number one homegrown solution is quality food.
Okay.
Because it's what you eat that helps you build the immune system. If the quality of what you eat is wrong, you cannot have a strong immune system. So first and foremost, go back to the basis. What is the type of food that you eat at home? What type of food do you eat? What do your family eat? What do you have? There's what I call differential nutrition. That it's not every food that every member of the family should eat. What children should eat should be different from what adults should eat. You're having a baby that is less than 1 year, that baby is supposed to be sucking breast. But you can't share breast to everybody, breast milk to everybody in the family. So again, people don't understand that nutrition is critical to immune response. People eat all manner of things. You are there in the fast food joint, eating all manner of fried items. As an adult, you have 70 years, you have 50 years, you have 60 years doing that. That is not healthy enough. So the number one homegrown solution is quality food. Eating food with a lot of green vegetables, a lot of fruits and vegetables, eating what is right. And that will help your body build immune system.
What about exercise?
Of course, exercise is part of the whole gamut of things that need to be done. But I was just saying that, look, nutrition first, exercise follows.
But the point is having, a very good immune system.
Exactly. And a good immune system, the number one determinant of it is what you eat and what enters your mouth.
Well, thank you very much, Dr. Terfa. It's been a pleasure chatting with you. And then, of course, so we are hoping that by the end of 2021, we must have, developed that herd immunity against COVID-19 in the country.